Good evening. I am Dr. Kapil Singhal. I am a senior consultant neurologist in Max Super Specialty Hospital, Vaishali, Ghaziabad. Neurologists usually see disorders which are associated with brain, nerves, or spine. So, what are the common neurological disorders which we usually come across? The usual disorders which we come across are headache, epilepsy or seizures, stroke or paralysis, tremors, numbness or weakness in different parts of the body, difficulty in walking or imbalance, backache, neck ache, pain in the neck. List is very long. Today we are going to talk about, in brief, about stroke, which is of high significance because it is many times unrecognized and not treated at the right time. Stroke or paralysis, or what we like to call at times as brain attack, is an emergency in which there can be weakness in one part of the body, there can be change or unclarity of the speech, there can be difficulty in walking, there can be difficulty in holding objects, difficulty in lifting legs, which usually occurs within seconds. You don't have time to recognize the symptom in the sense that they don't come with an alarm or any warning thing. So if a person has any of these, like sudden change of face or sudden deviation of face to one side, sudden change of speech or unclarity of speech, or weakness of the one part of the body, then he possibly is having stroke. And it is an emergency. Like heart attack, brain attack is also an emergency and immediate action has to be taken. Treatment is available for a very long period of time in India and all the parts of the world, in which an injection, which we called as thrombolysis, can be given in cases of stroke which are due to clotting in the brain. This injection works wonderfully and the results are very good, and it can change the life of a person in the sense that being disabled for life can be changed to normal activities of the patient. But the thing is, we don't recognize the stroke symptoms at time, we ignore the symptoms, we don't reach the right hospital. So what is the right hospital? A right hospital is a place where at least a CT scan or MRI brain is available, a neurologist is available, and adequate stroke care can be taken here. But the most important thing is to recognize the stroke symptoms. So if you have any deviation of the face, or the voice becomes unclear, or there is weakness of one part of the body, the patient is possibly having a stroke, you rush to a place where adequate treatment can be taken and treatment can be started at the right time. Identify stroke, stop stroke. Thank you.